Good morning, everyone. Thank you so much for joining in person and online. I'm so delighted to introduce you to Dr. Ana Clara Duran, who is a Research Associate Professor at the Centre for Food Studies and Research and in the graduate program in Collective Health School of Medical Sciences, University of Campinas, Brazil. And fellow at the Centre of Epidemiological Studies in Nutrition and Health at the University of Sao Paulo, Brazil. And we have a lot of very exciting research to discuss, which I'll let Ana Clara talk us through now. Thank you.
Thank you. Let me just see. Can you hear me? Yeah. Okay. So thank you all for having me. So yeah, I'm going to present the work that I've been coordinating in Brazil with the help of a lot of very brilliant people, in which we're evaluating the school feeding program in the country and looking at how much the food procurement of the program can actually change things. As I said, it's like a team, a brilliant team from across the country. So I'm very proud to have been able to get together researchers, professors, students from universities in the north, where the Amazon is, the northeast, the southeast, the south, and as well, I've been collaborating with Professor Anne-Marie Thow here from the University of Sydney, who's also like working on the qualitative part of the research. I'm going to be talking more. So this work has been funded by the Bloomberg Philanthropies through a partnership between the University of Carolina in Chapel Hill and the University of São Paulo. And very, very happy to say that oh, no worries. Sorry, yeah. Can you all hear me now? Yeah. So as I was saying, and then I'm just happy to say that I don't have any conflict of interest to disclose. This work is fully funded by a philanthropies. So for those of you who don't know, the school feeding program in Brazil, it's a very long standing. It was first created in 1955. It's universal, and it has always been universal and free of charge. I mean, it's always been free of charge. And then over the past few years, the reach of the program has increased, and now it's universal to all students from early education all the way to high school and adult education. So nowadays, the program serves over 40 million students all over the country, in every single municipality of the country, which is in all public schools. So, and 80% of the population, the school age population in Brazil is in public schools. So that's pretty much 80% of all the kids and teenagers who go to school. The program serves 50 million meals a day, 10 billion meals a year. Just a few figures to show like how big the program is and how the reach of the program. It is also the first program to have mandated that a percentage of the foods must come from family farms. That happened in 2009. And it also has a very strong social control and public participation. I'm going to be talking more about a little bit of the recent change of the program. And in terms of funding, the program is funded by the federal government and with supplemented by local funds from state and cities. So as I was saying, the program was not the program as we know today, but like the first version of a school feeding program in Brazil was first started in 1955, but only after 1988, with when the new constitution was promulgated, the program started having like the form that it has today. And here a few marks that are very key to what we're studying or we're presenting today. I'm going to highlight, for instance, the executive order of 2000 that mandated that all cities and states must have school feeding councils, which made the public participation a very key part of the program. And in 2009, a new law was the first actual law of the program with like with all the details of the program was signed. There was like a few different laws signed over the years, but then this law in 2009 kind of like concentrated all the details of characteristics of the program. And that's when I said like a lot of the executive orders have been, transformed into like a stronger legal instrument. And that's when also the procurement from family farmers became part of the program. And then in 2020, here I put like 2022, but actually the resolution was passed in 2020, but because of the pandemic, it was slightly, like little by little, it was implemented. So then the program became the regulations of the program were aligned with the Brazilian dietary guidelines. And then starting at that point, only up to 20% of the federal funds can be used to procure foods, processed and ultra-processed foods. So now the program not only had the procurement for the program not only has to comply with the school to farm regulations, but also to restrictions to ultra-processed foods. And so those two things that we are actually mostly interested in, I'm going to be talking more about in this presentation. And those are the two key things, two key characteristics of the program that we're evaluating this study. So this is, as I said, like it's a large study we're calling NI, which means short for Impact Evaluation of Brazilian School Feeding Program. So we're working on understanding the effects of the program on diet, economic development, and also governance. In terms of diet, we have started by looking at the share of processed and ultra-processed foods in school meals and whether that has changed after the restrictions were passed. So first we start by looking at how cities and states were, what they were buying for the program. So I don't know how it works here in Australia, but in terms of who manages the program locally, but in Brazil, like what we call like a school district, it is a city or state. So here for this study itself, we looked at only the cities, which is not only because 5,500 cities across the country. So all the school districts and cities, they are responsible for education, for children from 0 all the way to 14. In some places, they're also responsible for high school as well. So we were able to get data from the accountability reports from the Ministry of Education. So how does it work? So every year, cities have, in order for them to keep receiving funds for the following year, they have to report everything they spent the money with the previous year. And that report must be approved by the School Feeding Council. So that's like how the public participation acts. So the School Feeding Council not only has the role of advising, making sure the rules are being followed, but also approving the budget. So we're able to get that information. It's very granular information, food item by food item, city by city. So it's millions and billions of lines. And we classify that data according to NOVA, to the classification of food based on the degree of food processing. And working along with folks from the civil society, we show that even before the program, the restrictions were started, already 40% of the cities in the country were already complying with the minimum threshold, the maximum, in this case, threshold of purchases of the spending that should come only for processed and ultra-processed food. So which showed us that it is feasible. And why this was very important to be shown, because as you all probably imagine, there was a lot of skepticism. Is it really even possible to restrict ultra-processed foods at such a high program that has such a high coverage, national level? We show it's probably possible, feasible, because it was already being done in 40% of the country. So we looked at the data and to also see how there were differences across regions. So Brazil, as Australia is a very large country, very diverse, with wealthier and less wealthier regions. Just so you have an idea, the Southeast and the South are the wealthiest regions of the country, whereas the North and the Northeast where the Amazon is, everybody knows that, are the less, has less resources, poor regions. So, and also in terms of production, supply of food, they vary a lot. So it makes a lot of sense to do not look at Brazil just as one as a whole, but actually understanding the differences across regions. And we have shown that in terms of, so in black, in the gray, the dark gray, it's processed, and in light gray is the share of ultra processed. So if you combine both colors, it's the share, the 20% share. But I think it's important for us to show only to look at them separately, because I mean they have very different effects in terms of health. So we've shown that if there was a significant decrease, there was already a significant decreasing trend across time. But there was not shown across the country. And then we looked at why we were trying to explore some of the drivers of such decrease, of those such changes. And then we ran some fixed effects models. And we found that, for instance, the cities with higher GDP that had a larger share of schools with school kitchen that were run by a third party, and that had more resources, as we were expecting, that the local administration was putting more money. And finally, cities that had a larger share of purchase from the family farmers had greater decreases before the restrictions were implemented. So that kind of started showing us what was driving such changes and such differences, especially. And then so we've been collecting that data and treating that data as they come. So we finished as we finished treating the 2021-2022 data, we start looking at what's going on after the program. I'm going to say that I was very skeptic myself that I would see any changes in such a short period of time. One, because it's a very short period of time, and two, because there was a pandemic. So Brazil schools were closed for the most part from March 2020 all the way through April, July 2021. So yeah, it was a very large time the kids were out of school. The program was completely a mess, pretty much. It wasn't dismantled, which was great. I can talk more about it if anybody's interested, but it was a mess. Some schools were delivering foods to students, some students were coming to school. So I wasn't very confident I would see anything, but we started looking at the data and we did fine. So we ran some differences models, and we showed that there was, so if you look at, so these are just some initial findings. I mean, we're trading more the data and data to see, but we compare cities where before the pandemic did not have already were complying. I mean, already we're spending less than 20% of their funds, with cities that were not spending because we were expecting to see greater changes in cities that were not complying with the restrictions before, and also because we didn't have a good control. As anybody here who has any experience with evaluating the impact of policies, having a counterfactual is always great. I mean, we need a counterfactual. If you can do we're in the perfect world, we start the program, and then we evaluate as they go, we have a good control and a good treatment. That's not the case in most times when you're looking at policy. That's why we have to run these quasi-experimental designs in order to try to figure out, understand if there was any changes. So that's how we've treated the cities that were already complying with those thresholds before as control, and the other ones as treated. And I did see like there was differences, and even that short period of time. And even with to 2021, look, we thought 2021 year it was going to be really like messy and complicated, but for some, schools were able to at least, I mean, the way they're delivering the food to students was different, but at least the way they're procuring kind of kept somewhat okay. So this is just to say that it's not only it's feasible, but it's happened. So the restrictions of ultra processed foods, at least in the early phases, have resulted in decreases in purchase. In terms of the procurement from family farmers, what we found is also been looking at the data. As you can see, like so in blue, in darker blue, are cities that have procured the lesser amount, spend the less amount of their funding with foods purchased directly from family farmers, and in darker red, the ones that 100% of their funding is devoted to family farmers. As you can see, the country has become a little bit more red than blue, so showing that more and more cities are able to comply with this resolution as time go by. I think one very key part of this regulation is, as happens anywhere when we're talking about small farmers, the bureaucracy that they face to be able to achieve and meet all the needs for government bidding and stuff is very high, and they cannot comply with that. So the program innovated by removing that very key barrier, and which was the requirement of public bidding. So the program introduced a innovative legal instrument that cities can buy directly from family farmers through like a public call, like a direct call. They can also, cities are also allowed to pay a greater amount for the unit costs can be higher than if you're buying from like regular suppliers. So just so we have a more general idea of how this works. And then again, we're looking at the drivers of compliance over the years, and we have found that as expected, cities that have the largest share of family farming establishment as compared to the overall number of farms and have had a greater compliance over the years. Also cities that have a greatest share of cooperatives of smallholder farmers, which also has had a greater compliance, which is also expected. And then we also found that cities that were governed by left-wing mayors were also had greater compliance than those ones that were governed by more right-wing. And then what about the effects on the livelihoods of the farmers themselves? So we are able to look at that using the same data that I just explained to you, they're using for understanding the effects on the restrictions of ultra-processed foods. So what we did, so we got information before and after the data, and this data, and also data on the agriculture census. I don't know if you have something similar for Australia, but every 10 years, the Bureau of Statistics, the National Bureau of Statistics, run a agriculture census. So we got that data from before and after the law was implemented in 2009, and so we could compare the changes in terms of production and other related outcomes such as GDP, revenues, and the generation of jobs. So what we found is as control, again, we don't have a good control because the program is all cities can access the program. Not only can, but they do access the program. So we have to come up with some sort of control. So for the control, we got cities that were buying below the 30% threshold, and for treatment, the ones that actually compliant in 2017 was complying with the 30% threshold. And what we've shown is in those cities that were complying, they were spending at least 30% of their funds to buy directly from family farmers, a shift in the production from conventional agriculture to family farming. Why is this also important for not only, their livelihoods of the family farmers, but also the environment and food systems as a whole? So in Brazil, as probably most places, family farmers are less likely to use a greater amount of pesticides. They are more likely to plant food rather than just commodities, vegetables, legumes, rice, rather than soybean, corn, and sugarcane. So this shift has also kind of represents that. It's not only a shift in terms of livelihood for them, but it's a shift in production and potentially a shift and definitely a shift in terms of what's being, produced and the use of pesticides and so on. So we've seen like the shift in terms of agriculture and also livestock. We have also, and then with that information, we like here it was like a fixed effects model as well, a different model. And then with that, we're able to use input and output model. So for those of you who don't know, most say it's pretty like standard econ method to have like a sort of like a time how can I explain this? So it's like it's everything that all sectors of the economy are like, in this huge spreadsheet, let's say this way. So I'm just trying to explain because I know we have like an audience of different, and not only like economists, but also some public health and nutritionists. So it's like a spreadsheet of every sector of the economy. That's what like an input-output table is. And then we're able to input some of those parameters in terms of the shifts in the production of just the small amount of the revenue of the transfers that the government does to local cities and states. Why am I saying just? Because it's very small compared to Brazil's GDP and Brazil's and the impact of the agricultural sector in Brazil's GDP, which it's over 30% of GDP of Brazil comes from agriculture. So very, very tiny amount of funding has resulted not only in the generation of 40,000 direct and indirect jobs, just in the family farming sector alone, and also contribution to GDP. So just to say that, so something we're just discussing before we started, like, the potential impact. Before like looking at all this, starting studying this, I was on one side more hopeful that I would find like greater results, but on the other side, like very skeptical because the amount of funding is very tiny compared to the overall, subsidies that like large agriculture receives in the country. And I'd say probably here in Australia as well. But yes, we do find a very potential for shifting things. If we increase the amount of funding or for this program and increase the subsidies for large agriculture, could only imagine what the results can be. And in terms of governance, we're looking at why some cities implement better and other cities don't. So we're running some interviews with stakeholders that include delivery management, democratic participation, food supply, technical support, and legal support. We're finishing the interviews. Folks are doing the interviews right now, and then we're supposed to finish by January. So here, just like to present some like the initial findings that we got. So we looked at only the interviews with the nutritionists who run the program locally. So that's something else that the law mandated. Every city and state must have a nutritionist, which is a registered dietitian that is in charge of the program. to sign off the program and plan the menus and so on and so on. Coordinate the program locally, right? So so in our sample, we have a sample of 16 cities across all regions of the country, which are also being, I'm going to talk a little bit more about like the next steps. And they're also part of the quantitative, the survey of the national survey that we're conducting. So in this preliminary analysis, we use data from 1 interview from the North, 1 in the Midwest, 5 in the Northeast, 1 in the Southeast, and 2 from the South, just to start understanding like how they see the facilitators and the barriers for a more optimal implementation of the program. And what we find is, so we've been using the theory of Lipsky, the street-level bureaucracy theory, because they do have, ability to do or not do, at the local level, what the law institutes. So what we found is like what they've said is like when they have more political autonomy to exercise their functions, things run better. When there's more funding locally, when they have had previous experience working with healthy foods. So those who have like mentioned, no, they've worked in other settings, even in other, like not only school feeding, but also like other areas of nutrition. When those who have had that experience have said they were able to leverage that into their everyday work. And one thing that was very interesting that we found is like they all mentioned, like they all know, like, so what rose from the interviews, like how when school cooks are creative in coming up with good new recipes and ways to prepare foods, also the programs runs more smoothly. But they have also pointed out some hindering factors. For instance, very few personnel at the local level to supervise and adapt school menus, because most cities have we have 2 ways of running the program, like so centralized, which totally centralized, where all not only the planning, but also the execution of the program, like the procuring, distributing of the items are all done centralized at the city hall. And there are some cities that are decentralized, where like the planning of the menus and the coordination is done at the city hall, but then schools have some, ability to adapt things. And then there's a third way, which is like a mix, which is the city hires a third-party supplier to deliver the program locally at the school, but it's still organized, it's still planned, the menus are still planned at the city hall, centralized. So they've all said like the very few personnel can be a hindering factor. In terms, they've also mentioned the not knowing the farmers locally and what they produce is also hindered the ability to plan better menus. And also they've mentioned the lack of diversity of the farmers. So if they don't know them, they know just a few that only produce, I don't know, like carrots and not, I don't know, tomatoes. I'm just making up like some crops here. Kind of, make their lives harder. The higher cost of those foods. One thing that was very key they came up was the position of this community to the new regulations. So especially the restriction of ultra-processed foods. And actually not only there is a restriction, but it's like, some like ultra-processed foods such as sugar drinks, a few snacks that are high in salt and fat and saturated fat are completely forbidden in the program. And sugar for kids under 3 as well. No sugar is allowed. So they've mentioned like a greater position from the school community, not only from the school cooks, but also from like the school principals and the parents, of course. Not to mention, the kids are just part of the community as well. So they have to, use a lot of their time to talk to them, to talk to each one of those, stakeholders of the school community to convince them and bring them on board. And finally, problems of, logistic issues of food supply and delivery. Some cities do not have the infrastructure and the schools on how to receive the foods and so on. So just a little bit of the next steps, which I hope to share with you all in the near future. Now we're running a national survey across the country in 77 cities in 273 schools, and we're interviewing for almost 5,500 elementary school students. And the idea is also now to understand how the program, as I said, like with a very brilliant team. This is like just a picture of them in the training when they're training the interviewers. And the idea is to understand the effects of the program now in the dietary intake of the students, in the household food nutrition security. We're also looking at gender and care economy in terms of like, so kids whose parents, most of the time mothers, are the main caregiver, mothers whose kids go to school full time, they, gonna have more free time for themselves to invest in themselves, in their careers, in their education. So we're also looking at that, and also access to drinking water and availability of competing foods. So again, we don't have a good control. So the way we're doing it is we're comparing kids who go to school, in schools as well, that go to school full time with part time. The full time, just over the last, say, 10 years, that Brazil has been moving into full-time education rather than just part-time. So we're able to compare, and in our hypothesis is kids who are exposed to 4 meals rather than just 1 meal. Of course, they're going to have a greater. First, not only this hypothesis, are going to have a greater impact of the program, and also using the data that I just shown to you in terms of implementation. So we're comparing students who go to schools in cities who implement better the program with those cities that implement worse the program in terms of the share of the purchase of ultra-processed foods. So that's it. Thank you so much. And if you have any questions.
Thank you so much.
You're welcome.
Can you hear me online? Does anyone have any questions in the audience?
I have a question online if it's.
I know. That story, everyone.
Thanks very much for your talk. I was just wondering how many students typically eat at school, and do all schools feed kids? I know in Australia, pretty much everyone brings lunch to school and that sort of thing. So just wondering.
Yeah, so for elementary school, pretty much everyone who go to public schools. High schools, they're like, because high school, the program has only been serving high school students for what, a little bit like 15 years, 20 years. So there's still like a few schools that still have, snack bars, canteens. So, kids end up buying foods from the canteens. But yeah, so for elementary schools, pretty much all of them eat, but of course not every day. So there's like some, there's another survey, like a school, health school survey that has shown that roughly 70% of the elementary school kids do eat most days of the week, 4 or more.
Thanks so much. I just wanted to make a comment on the methods. I think it's really rare in public health nutrition research to see such strong quant methods. We have a statistician here in the room drawing on I'm not going to even explain what you did, but very strong quantitative basis across using a lot of data sets, and also bringing in Lipsky's street level bureaucrats theory. So I found that really interesting. I had a question about, you talked a lot about processed, ultra-processed foods and NOVA classification. I saw towards the start, there was a mention of like 200 and something grams of fruit and vegetables per week, I think, or day. I was wondering whether you've done any research on, I have done a lot of research myself on measuring how many fruit and vegetables, like the quantity is eaten by populations and how that can be increased. And I was wondering whether that's been looked into at all.
Mhm. Not yet, but we are. So as I said, like, let me just go back a little bit here.
I also noticed towards the end you were talking about cost of healthy food, so interesting in that as well.
So yeah, so I've mentioned, so if you look at here, then the new resolution not only restricted the purchase of the procurement of the processed foods, but increased even more the minimum servings of fruits and vegetables per week. So I think it was 200 in 2013. They went to 280 grams per week, which is like roughly 3 times a week at least.
Yeah.
So vegetables every day, fruits at least 3 times a week. So we are going to be looking at the effects on diets of the students. In terms of the share, we haven't really figured out how to use the procurement data to check that. Actually, we could discuss that more. We've been starting to look at this. And also in terms of the cost, we are planning, so I don't know, anyone has worked with this kind of data in terms of especially pricing. The pricing has been the hardest thing for us to treat because, you know, cities can buy lettuce by the head, by kilograms, by bunch. So that's why we've been treating, just to look a little bit more on the cost. And then, one of the ideas to have actually, there's a researcher that's going to be looking exactly on whether like the requirements are being met, and also if there has any impact on the overall diet of the children. So as you said, like, if we're doing a 24-hour food recall, so we're not looking only at the meals they receive at school, but overall. So our hypothesis is like kids who eat more days a week, and also have more meals, those who go to full-time school education, they're going to have a greater share of vegetables in their diet overall.
Thank you so much. Yes, there's so much complexity and interesting to think about city level purchasing as opposed to household level, which can be a bit easy to deal with. Online, do we have any questions?
I think Dory had a question.
Yes, can I jump in?
Please, Dory.
Thank you. Ana Clara, thank you very much for this really, really excellent presentation. I think this entire case study or case is very inspiring for other countries, and I hope it's inspiring for Australia too. I particularly liked how, you know, in most of the time, as Penny mentioned, in health research, we are only addressing issues from a health or nutrition perspective. But I really liked how your study also looked at the socioeconomic impact, because we know that with food systems research, we also need to think about what other drivers are there, what other interests and priorities are there. And it was really nice to see that the impact was positive on the livelihoods of families as well, and also on environmental sustainability. My question refers to research on this area. I was wondering, what kind of research do you think we need to do to have a better understanding about how public food procurement or school feeding programs can actually support healthy diets and better environmental outcomes and sustainable livelihoods, but especially in a context where agribusiness corporations are really strong. I know in Latin America, in many countries, they are really strong. We have a lot of arguments or discussions around in Australia as well, that some of the food industry corporations and supermarkets chains have a really big impact on how nutrition policy or nutrition is shaped in the country. Can you give us some suggestions on how we should approach research, but particularly around public food procurement? Thank you.
Yeah, that's a very good question. So I've been thinking about discussing this a lot lately. So one way that I've been thinking, and I very welcome suggestions on that, is to compare how the program is run and the effects in countries where the agribusiness sector is stronger rather than countries where they are not as strong. Unfortunately, all the most richer, biggest countries that have more complex and more established programs also have a very strong agribusiness sector. So, which makes it hard. No, we don't have a good counterfactual here as well either. But that could be one way of looking at it. Another way is to try to like run some like simulation models to try to like play with the level of subsidies rather than with the level of funding that goes into not only like school procurement, but also other types of funding, like loans for small farmers. I think we should be be more creative into bringing those type of not only methods, but also data. I do agree that in public health, we don't use them much. Actually, like, so I teach epidemiology, and a lot of the, hardcore epidemiologists, don't like very much this kind of, administrative data. They think it's not good. I mean, it's messy for sure, but also they're very rich, and most times they're among us, which means even if they're not, super clean, perfect, we can figure out ways to work with them. So I think, so one thing that I've started working. So I think sometimes it's what I've, become closer and closer to the field of economics, because they tend to work more with commercial and administrative data, often generated data. So that's one thing that I'm trying to not only like bring to the field, but also advocate for more, public health experts, epidemiologists to use all that information, because it's weird. If you're only like looking at like those perfect surveys conducted by our like National Bureau of Statistics, we may be missing a lot of things that we can explain. So that's probably how I would answer your question, Dory.
Thanks a lot, Ana Clara.
Thanks so much, Dory. We probably have time for one more question. Not essential, but does anybody else have any questions online or in the room? Thank you. Please join me in thanking Ana Clara very, very much. I think that we're going to have a lot more questions in the future, and looking forward to your future presentations as well for the results of the next phase. Thank you.
Thank you. Awesome.